name is Sylvia, and today I will be doing a central line dressing change. Um, as a responsible and ethical learner, I will uphold personal integrity by not engaging in any form of cheating, unauthorized collaboration, fabrication, falsification, or any other act that compromises the integrity of the skill testing recording. So I will go ahead and start by coming into my patient's room. I'm going to perform hand hygiene, and I'm going to address my patient. Hi, Mr. Smith. My name is Sylvia, and I'm going to be your student nurse today. I'm here to change your dressing on your catheter line. Can you please verify your name and date of birth for me? Okay, Mr. Smith, perfect. And I will go ahead and verify that against the MAR and against the patient's bracelet. I will start by asking my patient if he has any allergies to chlorhexidine, any adhesives, and by this time prior to coming into the room, I have already reviewed the policy for catheter insertion in regards to the facility I'm working with. So anything with hemodynamics and any preparation that needs to be done prior to me performing this skill. Then I'm going to assess my current dressing on. So usually dressings are changed between 5 to 7 days unless they are soaked or there's a reason why I need to change it. If I suspect any dislodging of the catheter, I will go ahead and also change the dressing and go from there. Okay, so I'm going to start my skill after I have identified my patient, reviewed allergies. I'm going to start by, again, performing hand hygiene again. I'm going to grab some gloves, and I'm sorry, my gloves are all the way over there. So let me grab that really quick. I apologize. Okay, sorry about that. I'm going to start by putting on some gloves myself. From here, I want to make sure that I provide a mask for my patient and instruct my patient that when I am performing the dressing change that he turns away, just because we want to avoid any bacteria going into the site. So, Mr. Smith, I'm going to go ahead and put on this this mask on you. I've already done that. And this is just to prevent any infection. I will go ahead and do the same for myself. I will open up my kit, and for now, all I'm going to do is I'm going to grab my mask, put on my mask, make sure it's nice and tight. Okay, so now I'm going to ask my patient, okay, Mr. Smith, this is the time that I'll ask you to please turn away. And that way I can have a clean area and there's no contamination. I will start by removing the current dressing. And if I need to, I will go ahead and use adhesive removers. But for now, Mr. Smith's dressing is going to cooperate fully with me, so I can just do it with and I want to just be careful as I'm removing the current dressing that I hold on to the tubing and there's no dislodging. Okay, I have already removed it. Now what I'm going to do is I'm going to measure the tube. And what I will do is go ahead and measure from the skin to the device, and that is about a 21 centimeters. I will go ahead and check on the MAR to make sure that that is the correct measurement especially if I suspect of any dislodging. So now what I will do is I will take off my gloves. I will perform hand hygiene. I will open up my sterile kit, and from here on it will have to be sterile. So I will open this up, and the first thing I want to do is make sure I grab my gloves, put this aside, and then this will be my sterile field. I'm gonna use this just in case I need to set something in the bed, just in case. So this area is sterile, and I will just let Mr. Smith know. Mr. Smith, I'll just have you keep your head over to the side. I do have a sterile drape on your right side, so just make sure you keep looking over to the left, okay? What I will do now is I'm going to throw in my device in here. I will start priming my syringe. Okay, it's primed. Put it back. Set it there. And then I will start with my gloves now. Excuse me, my hands are a little wet from the soap I used right now because I washed my hands. Okay. Okay, hands are sterile. This goes to the side. Now, this is what I'm working with. This is sterile. I didn't touch the outside, just the inside, so I am still sterile. Now, what I want to do is I'm going to use a gauze just so that I can maintain my hands sterile, and I will be using this gauze to hold on to the tubing. That way, if later on I need to use my right hand for whatever reason, I can do so. Okay, I will go ahead and start by cleaning. Okay, Mr. Smith, I've already explained the procedure to Mr. Smith, so he knows exactly what to expect. He knows what the reason is for me performing this procedure. So I will go ahead and start, and then I'm going to start by cleaning the skin. Okay, now I'm going to clean the tube. Okay, now I will let it air dry. We wait a couple minutes, let that air dry. Now I want to put on my holding device, and it's going to be the blue part is going to be up. So now I'm going to put this, and I can grab my gauze again since it's clean. Put that in the middle. Make sure it's nicely secured. After I have done that, so now that I touched the tubing, this hand is no longer sterile. I will go ahead and secure with my hands. And there's a piece on here that I can remove. And here I want to make sure that I put today's date, the time, and my initials, just so that the next person knows when it was changed and by whom. If I had a locking device, I would go ahead and use that, just to make sure that it would stay in place. However, I don't, so I will be using tape. What I will do now is I'm going to go ahead and flush my tubing. Okay. I'm going to remove this part and put a brand new cap. Grab an alcohol wipe. Clean the hub 30 seconds. Fully clean the hub. Draw back. Flush. It's flushing. Okay, line is good. Make sure that I cap it. And that's that. And then, like I mentioned, if I had a device to secure it, I would go ahead and secure with a device. Now here what I want to do is just make sure and clamp it. I want to clamp it. And then I want to tape it to secure it and prevent dislodging. I want to then gather all my supplies, clean up the area, assess my patient for any response, make sure that my patient tolerated the procedure correctly. I am going to take off my gloves. I'm going to bring the bed all the way down. And then I will make sure that I document all of the steps, the procedure, how my patient reacted to the procedure, and then I will then come to Mr. Smith. Okay, Mr. Smith, I am all done. Now I'm going to clean everything up. There is no need to wear a mask anymore. Thank you for your cooperation and helping me out. I really appreciate it. So now that we are done, do you have any questions for me? No, my patient is clear to go. Bed down, locked. He's in a position where he wants to be. Call light is on the side. Everything has been cleaned up, and I am all done. Thank you.